Okay, good morning. Thank you for the opportunity given to me. I want to introduce myself. My name is Leila, Nisya, Ayuanda, and my team. They are Nur Intan, Kusuma, Nur Izzah, and Nur Chabibah. And on this occasion, I would like to present my research article with title Pregnant Women's Perception of Psychoeducation Services by midwives. I feel stronger and accept my pregnancy. Okay, next slide. Yes, they are outlined. First, background. Second, objective. Third, method. Fourth, result and discussion, and the last, conclusion and recommendation. The background are during the COVID pandemic, pregnant women become a vulnerable group. So pregnant women were worried about their pregnancy. Pregnant women require a special attention and services related to preventing anxiety so that it did not manifest in more severe psychological disorder. In this case, midwives have a role in preventing a psychological disorder in pregnant women through psychoeducation services. However, there was no evidence regarding the benefit of this service for pregnant women. An objective, the purpose of this study was to determine the perceptions of pregnant women regarding psychoeducation services by midwives. The method of this study was a qualitative research with a case study approach. The informants in this study were 6 pregnant women. Data collection used online interview with asynchronous and asynchronous and the WhatsApp platform using an instrument in the form of a semi-structured interview guide with a previous audio trail. The data was analyzed using thematic analysis with the Miles and Huberman framework. There are result and discussion. This study finding the result with 5 themes were obtained. First, the psychological condition of pregnant women. Second, perception of pregnant women. Third, the benefits of psychoeducation for pregnant women. Fourth, psychological needs of pregnant women. And the last, the effort of prevent anxiety in pregnant women. Discussion. First, the psychological condition of pregnant women. Pregnancy and childbirth are unique life experience for a woman, not only physical but also complex mental and emotional changes. Most pregnant women do not know about a psychological change and the impact of this change on pregnancy. Besides that, pregnant women often experience anxiety, fear, and even depression. Anxiety is a normal form of a psychological adaptation to the psychological changes that occur in women during pregnancy. During pregnancy, adrenaline will increase, resulting in biochemical disorders. The body will feel physical tension. Pregnant women will be irritable, lack concentration, and even want to run away from real life. Okay. Second, perception of pregnant women. At the beginning of pregnancy, pregnant women pay attention to their physical condition, while psychological or mental health is usually forgotten. In fact, mental health that does not receive proper most pregnant women do not know about psychological changes and the impact of this change on pregnancy. A number of things can influence the achievement of the mother's role by mother's factor, namely the mother's age, mother's perception, social stress, personal characteristic, health, and others. Second, in the physical and psychological condition of the baby itself. Third, social support factor include the support safe. Fourth, there are other factors which include economic, ethnicity, status, and so on. Third, the benefit of psychoeducation for pregnant women. In general, the aim of psychoeducation is therapy to increase the client knowledge and cognitive ability in treating an illness so that is hope that it can reduce level of anxiety and stress. This is in accordance with the benefits received by pregnant women, namely increasing pregnant women's knowledge related to mental health in pregnant women. Midwives support psychoeducation is not only efficient in improve maternal health outcome, but also competent in reducing obstetric care costs. This is complemented by the statement that midwife support care benefit maternal health. The authors start that mother who receive midwife support care during the antenatal stage of pregnancy were less likely to experience severe labor-related pain and discomfort. Fourth, psychological needs of pregnant women. Pregnant women need a support from several parties for their psychological well-being. Sort of support that pregnant women get are from husband or partner, midwives, family, and even social media. A woman's ability to overcome childbirth anxiety not only depend on her knowledge about the pregnancy and childbirth, but also on how much support the pregnant women receive from the people around her. Based on a fact in the field, midwife almost never recommend that a mother see a psychologist for the psychoeducation in uh, K1. Yeah. The first meeting in antenatal care is complete. Yeah. The mother actually needs help, but the midwife feels reluctant the explore the mother's feeling, worried that she will be seen as wanting to know more. One of midwife support is providing a psychoeducation regarding mental health to pregnant women. Fifth, the effort to prevent anxiety in pregnant women. This research show that effort to prevent anxiety carried out by pregnant women are a coping strategy to prevent anxiety consisting of four approaches, namely a biological approach such as yoga activity to reduce anxiety, and then a psychological approach such as think positively and relaxation for the pregnant women, uh, and then a social approach such as a social support from husband, from family, or midwives, yeah. And the last, a spiritual approach such as surrender with God, namely tawakal, and then God get closer with God. Yeah. Coping strategies are designed to deal with situations and requirements that feel urgent, challenging, burdensome, and exceed your available research. A person's coping research will influence a coping strategy for solving various problems. Conclusion and recommendation. The implementation of psychoeducation services is an effort made by community health centers, especially midwives, to fulfill the psychological needs of pregnant women, namely support from midwives regarding psychosocial problems. This service providers benefits for midwives and pregnant women relate to improving antenatal care services holistically. So, psychoeducation services are needed that are integrated into integrated and antenatal care services. Service. Okay. Uh, that last, thank you for your attention, and I hope you can get this information from my article. Thank you.